Men with low-risk prostate cancer are more likely to die with prostate cancer than of prostate cancer.
In the United States, many patients with low-risk prostate cancer have radiotherapy or surgery that could do more harm than good because their lives would not be shortened by their cancer. This is the finding of a study presented at the Genitourinary Cancers Symposium by a Merit Award-winning scientist from Harvard University.
Doctors, both urologists and radiation oncologists, prefer to administer the treatment that they're capable of delivering. And the data has shown that. So radiation oncologists like to give radiation, urologists like to give surgery. What we found is that if you look at men who have a life expectancy of under 10 years, and they have a very early form of prostate cancer, we found that 2 out of every 3 of those men are being treated with radiation or surgery. And we think that's an important finding because if you look at the risk of dying of prostate cancer at 10 years in a patient who has very early disease, that risk is close to 0. So we have to really be wondering what benefit are we providing to these patients.
Complications is another issue, of course. What sort of complications are you coming up against?
Yes, complications is a major problem in the treatment of prostate cancer. The prostate's in an area where there's so many vital normal structures around it that any surgery or radiation is going to have its complications. So urinary toxicity is a big deal, bowel toxicity is a big deal, erectile function is a big deal. And as you can see, a very high percentage of these men are getting toxicity when they undergo either surgery or radiation. They're both toxic in different ways. And active surveillance, which bypasses that toxicity and potentially gives patients an opportunity to maintain their quality of life, really should be utilized more in these situations.
So how would you sum up the message coming out of your poster?
Sure. So men with low-risk prostate cancer are more likely to die with prostate cancer than of prostate cancer. And this is especially true in older men and men who have a lot of health problems. So this is a population of patients that really active surveillance is the preferred treatment for. And we need to do a better job of minimizing over-treatment in these patients to avoid toxicity and to decrease costs.